Hello, I'm Dr. Sri Banerjee, epidemiologist, biostatistician, faculty member, and in this segment, I'm going to be going over alcohol and drug use among the Hispanic population. So, for starters, it's important to know that Hispanic Americans are one of the fastest growing segments of the United States population. So, understanding the cultural milieu of what is going on is especially important. So, especially among the Hispanic population, according to the U.S. Bureau of the Census, there's 60 million people of Hispanic origin. And this is as of 2018. Of course, we're 6 months or 7 years beyond that day, beyond that year, but this is 18.3 percentage of the total population. This will, of course, by 2050 increase to over 30%, and according to 2050. And that's so Mexican Americans or Hispanic Americans health is especially important because of these rising rates. Um, Now, fusing on the understanding of the increasing in in the Hispanic American population, it is also important to understand the rates of substance abuse. So, from the National Survey on Drug Use (NSDUH), a data set that I've used previously, 7.1% of Hispanic Americans have a substance use disorder compared to a rate of 7.4% among the total population. So this is much higher than expected. Of course, Hispanic Americans report lower rates of lifetime illicit drug use. And most of my research, there is typically a higher preponderance of certain types of um, drug use disorders or other areas to determine. So there's differences across Hispanic population. So Puerto Ricans have the highest rate of recent illicit drug use. That's 6.9%. Other Hispanics, so the one that many students focus on is Mexican population, and they have the highest rate of recent cocaine use, while Cubans have the lowest rate. Of course, this doesn't mean that Hispanic population should be banned, but more understanding is necessary to understand the whole context. I know when I did my research now about 14 years ago, there was an increase among the Puerto Rican population, and how they did not receive medical care or did not have insurance compared to the white population. Of course, there's a lot of information on Puerto Rico run population, which I personally have interacted with in a lot of my research. But Mexican women drink the least of Hispanic women, and beer is the preferred beverage. Not that Hispanic or Mexican women have not been investigated previously, but there even in the fewer number of Mexican women that do drink, that there may be a gap there. So there's a team that is around 24/7 to offer compassionate, non-judgmental support, and compassionate care is especially important so that they don't feel stigmatized or they don't feel like they're being neglected. Um, so substance use is there's a discrepancy in treatment options and outcomes among Hispanics. Um, so even though there's no difference in the rates of substance use, there's a gap between Hispanics and the rest of the population when it comes to substance use treatment. SAMHSA reports, and SAMHSA is a service that I've utilized not only for research but helping others in this area. Substance use disorder for this population is not they're not receiving the right treatment that they need to a specialty facility. And so they end up having poor outcomes. So in some ways, Spanish-speaking activities and acknowledgement of Hispanic cultural values, such as family structure, gender roles, personal relationships, respect, spirituality, and religion. So, having to go into Catholic churches, and that is a common sort of religion among Hispanic populations, can increase this connection, or to address the disconnect between SAMHSA and the Hispanic population, perhaps increasing the amount of individuals that are trained to be more cognizant of the Hispanic population. Here are some areas that Hispanic populations more so reside in, and they've been color coded for different by what type of Hispanic Americans SUD is done. SUD is substance use disorder. So I'm just going to take a uh, more close knitted loop, a closely uh, interpreted loop on what happens in specific areas. So you can, what this is helpful for is you can click on these and take a look at what is going on in society among Hispanic Americans. There's help available, and so um, please be cognizant of these areas when you're doing research and understanding a better understanding this population in much better introspective way than what it is done currently. If you're doing research in this area, start here and then go further. I'm looking at some of the main databases as to what is going on. I hope this has made some sense. Thank you for listening.